Hi, it's so nice to see you, Sarah Nolan. Thank you for joining us. Today, we will be talking with Sarah Nolan, who is one of the newer additions to the True North team. Sarah has a long history of working with women in different situations, women who are experiencing a wide variety of issues. But today, we're going to really focus in on a special type of therapy that Sarah specializes in, and it is called EMDR therapy. So, can you first tell us what that actually is? What does EMDR stand for?
So EMDR stands for eye movement desensitization reprocessing, and it was developed in 1987 by Dr. Francine Shapiro.
Okay, all right. And so tell me more about it. So I don't specialize in this area, which is one of the reasons why I'm so excited that you've joined us, because this is something that we sometimes get calls for. People say, I'm really looking for this type of therapy, and I've heard really good things about it. And I too have heard really good things about it and know that it can be really effective. So can you give me an example of what sort of client might be a good candidate for this type of therapy?
Sure. So in its development, EMDR was first studied and standardized on sexual assault survivors, usually a one-time assault. And so through the course of standardization, it has later been named an evidence-based practice. So it is shown to be an effective treatment, especially for trauma. But it has now evolved and expanded. And so now EMDR has seen great results for individuals who are struggling with depression, anxiety disorders, personality disorders, and substance abuse. So there's a lot of different mental health applications for EMDR. And so my specialty is working with the trauma survivors or individuals who are suffering from anxiety or depression. And so those are the more common applications that I myself practice.
Okay, wonderful. So can you tell me how this type of therapy looks different, like especially for somebody who's maybe never been to counseling before, period? Can you sort of help them to see how it might be different to work with you using this type of therapy rather than a more traditional type?
So when before I got trained, so this is just kind of like a mini segue. Before I got trained, when I approached treatment, I was predominantly using cognitive behavior therapy, which is usually a bread and butter therapy treatment approach that a lot of new generation therapists are learning in graduate school. So if we look at an issue or a problem like depression, and we look at the thoughts, the feelings and behaviors and how that all connects, and we make those as adaptive and healthy as possible, then the depression symptoms would go away. So when I applied a similar approach with trauma-focused cognitive behavior therapy, it's applying those same principles, but in constructing a trauma narrative and revisiting trauma memories, and then identifying replacement thoughts, feelings, actions, and other things to make that story more adaptive for the person in the present. But what I was noticing is that for some clients, a TF, trauma-focused CBT approach wasn't quite cutting it. It was like, I know how to challenge these thoughts. I know this event wasn't my fault, but I could say that 100 times over, and I'm still guilty. I'm still carrying the weight of shame. And these memories are still interfering with my relationships and my well-being. And so I've told my story 1,000 times. I've done all the self-help books, and nothing just makes the punch. And so when I had worked in a rape crisis center prior to coming into True North, the supervisor at the time essentially said, I don't care what you practice, but we all need to kind of acknowledge that a one-style approach to treatment is not effective, because not all clients will be receptive or respond in that way, because clients come in with differences. And so TFCBT is great in its own way, but are you open to learning new modalities? And I, of course, said, sure, like I'm more the merrier. So they had paid for me to get EMDR training. And within that first training weekend, what the facilitator, a lot of the other participants were getting really hung up about, well, their thoughts are accurate and their feelings are accurate and all the things are accurate, so it should be poof, gone. But then something was clicking within myself that like, oh yeah, but trauma doesn't live in our rational brain. Trauma lives in our limbic system, our reptilian, our fight, flight, survival instincts. So we can't reason with trauma. And when we had parted for a break and I had said those new light bulbs to the facilitator, she kind of looks to her co-presenter and she said, she gets it.
Yeah. So it's using a different part of the brain, you're saying. So there are different parts of our brains that we use when we're thinking or when we're experiencing things. So if we're thinking rationally about something, we're generally using like the prefrontal cortex or the frontal cortex, right? But you're saying this is what they call the reptilian, like the back from the olden days type of brain. It's more of when you say fight or flight, what do you mean by that?
I just mean kind of our sympathetic, parasympathetic nervous system. So we're human beings, we're animals by evolutionary standards, and so we can encounter a fight, flight, freeze response in response to any event that our brains kind of perceive as dangerous. So when those kind of kick in, then our brain kind of defaults to these patterns in order to survive. We have to find
so they can like jump, or you can feel like if you're frightened or if you're scared, when you say fight, flight, or freeze, you could either fight and say, oh my gosh, this horrible thing is happening right now, or oh, I'm scared, and you might start like punching or you might start kicking. Or so that would maybe be the fight. And then what would be like a flight example?
Yeah, flight is just simply running away, finding some way to escape the danger. And freeze is, I've had some trauma survivors kind of say they knew trauma was happening, but they couldn't do anything. They literally could not move. Mm-hmm. You might, in a different animal example, you might think of an opossum who kind of plays dead to potential hunters out there. There's also been more research now on fawn, and so fawn is almost like appeasing the threat. If I make the threat or threatening person happy, comfortable, calm, then that is not as likely that they're going to act on any sort of rage or power and control needs towards myself, because they're happy and they're taken care of. And so
these are all ways to kind of deal with just, and again, what you're saying is that it isn't that a person sits and thinks, what should I do during this time? Instead it's just, this is what your body does. This is how different bodies react and different people react when something like this happens.
And not everybody will respond with the same response to each type of danger. You might engage in fight with one scenario, and with a completely different scenario, it's more of a freeze. So I've seen some survivors, at some point in the treatment process, be angry, with themselves of, I should have fought, or I should have fled, I should have done something. And we're like, folks, we don't get to control that, because our brain hijacks the system. And that's kind of what trauma does. It hijacks the system. It interrupts that prefrontal cortex, because you don't got time. You don't have time to think about it. There's danger. I need to think of what will quickly and efficiently, minimize all the risks and maximize rewards to get me through this or out of this circumstance. And so a lot of survivors just get so beat up on themselves of like, I should have, could have, would have. And it's like, yes, if we were in a space to think rationally, level-headed, grounded, and we had the luxury of time, then yes, we can make informed decisions about how to proceed. But when it's a traumatic event, survival is of the utmost importance. How do we keep ourselves physically and emotionally safe until the danger's over? Then we could take the deep breath and then figure out the next steps. But in that split moment, we rarely have control about those automatic responses because they're instinctual by nature.
Right. And so how do those different responses, how does EMDR kind of address that, or how are they connected to EMDR?
Mm-hmm. So usually when I'm working with a client and especially if they've already tried talk therapy and kind of hashed out the trauma intellectually, then I'm trying to illustrate to them how EMDR can kind of, allow a person's brain to kind of sit in both worlds. That yes, we need to have your prefrontal cortex online to illustrate the adaptive information, the things that your brain knows to be true about this event and where things have gone and progressed since then. But we also need to keep online the limbic system where the trauma lives. And that's where once it's activated, folks might feel the panic, the dread, the feeling that, oh, I'm back there again. So I need to be able to keep both of those spaces online at the same time in order for the brain to really process the event fully. And that's where, unfortunately, for some trauma survivors, they're not able to kind of come full circle after the event's over. Some individuals are very fortunate that after a horrible thing happens, they can pick up, dust the shoulders off, and be like, all right, let's move on. Some folks can't do that. It's not so easy. Trauma event happens, and pieces and fragments and aspects and feelings just kind of get lost and fragmented in the brain. And so then it just never really works its way through. And then it just shows up like nightmares, flashbacks, difficulties with relationships, difficulties with guilt and shame, because those are the kind of unprocessed pieces that have to be worked through. But I can't really work through them because it's like the minute I think of those things, it's like my brain either shuts it off or it numbs it out or it disconnects from those things. So it's like the brain kind of lives as two separate worlds, as like my logical self and my emotional trauma self. And those don't really work together. So EMDR is a great opportunity for both of those places to be online at the same time so that the whole brain is working on the event at the same time, not just the panicked, overwhelmed, traumatized self, and not just the logical, rational, adaptive self independently. They're working together to kind of communicate around an issue.
That's fantastic. That sounds great. Because I can see where a person could experience a lot of shame or guilt or just frustration with themselves, that they're like, I've thought this through a million times. I've said this a million times. I know the part of me knows that this isn't my fault, like you said, or I was really in this situation. There wasn't really much that I could do, but still the like you said, the emotional part, the intensity of the emotion and the smell, like when you smell something and whoa, you feel like you're put right back in that situation, or seeing something from the corner of your eye that makes you feel like that, or in more of a kind of classic way that they used to describe PTSD, where people who might be veterans of war would hear a really loud boom or a car backfiring, and then they would be like, they might hit the ground or feel like they're back in a combat situation, where again, that's not where they're sitting and thinking and saying, I believe war is happening right now as they look around. It's more of a physical, immediate limbic system. That's the limbic system you're talking about, right? Where again, that's kicking in and it's saying loud noise equals danger, equals get down, equals that sort of thing. So it sounds like something like this also can really help with people who are experiencing shame, because I think the two sometimes are so connected, experiencing trauma or experiencing, like you're saying, how this can be not only used for trauma, but also used for a myriad of different emotional problems that we have, like anxiety and depression and probably a lot of them, right? But a lot of those are connected with shame and guilt. Mm-hmm. And so to think, I am working on my brain because there is something in my brain that is not quite aligned with all of my brain. It seems like you're kind of putting things a little bit more into alignment. And like you said, just kind of putting things back together a little bit. Yeah.
And what I love about EMDR is that it doesn't just focus on the past. So working on the past is part of it. So they call it, there's a 3-pronged approach. So we have to go back to the past to figure out what are the past memories or experiences that are kind of fueling the present day issues or concerns. So one way to kind of phrase it, like if you think of what is bothering or upsetting you now, what's the worst part of it? And they kind of get it activated in their brain and they're like, oh, this is why it's icky. And then I go, okay, trace that back. If you trace that back without censoring it, where have you felt that feeling before? Because I think some folks might say, oh, I'm not a natural disaster survivor, or I've never seen extreme violence. But I think majority of folks in this world have encountered humiliating, embarrassing, upsetting emotional experiences. But, we might, say, well, one's bigger or better than the other. But at the end of the day, all of those hardships are valid. So it doesn't matter how we categorize it, whether it's small, medium, or large. If it took an emotional toll, it's valid. So if I trace it back and I think, oh, wow, why am I thinking of this random event at 8 years old where it seems so novel or nothing as an adult I would think of as a big deal. But when I think about it as an 8-year-old or 6-year-old, man, that was, really shame inducing. Like I could feel my, body recoil and my head go down. I feel like, the sad puppy dog kind of like recoiling. And it's like, well, just notice that, and let's try to use EMDR to kind of clear that experience out, so that it's not upsetting anymore. So once it clears out all the past stuff, and then we start working on the present. Okay, now when you think about current situations that are upsetting to you, how bothersome are they now? And so then the present day triggers and scenarios are also processed so that they're no longer disturbing. And then there is a future template. So we go through the past, we go through the present, and we're looking at the future. So now when you're looking at that upsetting scenario tomorrow, how would you like to approach it? We had a traumatic or visceral reaction before. Now that you've kind of grown in some different ways, how would you like to handle that now as an adult in 2023? I would like to handle it this way. All right, envision those steps and procedures with that type of scenario and go with that. So that's what I also like about it, because it doesn't just talk about the past, because it's working on the past, how to apply it to the present and apply all that growth to the future as well.
I love that. Can you give us a little idea? You don't have to go in great detail, but I feel like this is one of those therapy types that feels mysterious. It feels like magical. Like, how exactly is this working? Or what happens if a person were to come? What would you do to them, Sarah? What would you do to a client if you were doing EMDR therapy?
Yeah, I wish it was just as simple as I had the magic wand and I was like, boom.
Yes.
I think we'd all make a lot more money. But it doesn't work out that way. But what I would say is that for some initial sessions, we're doing a lot of history taking. We're making, just like any standard clinical interview, history of mental health issues, medical issues, history of mental illness. So we're doing all the kind of standard history taking in the beginning. And then that kind of transitions into what we call preparation. And so in that phase, it's phase 2 of EMDR treatment. There's 8 in total. So history taking is step 1. Step 2 is preparation. And what we're essentially doing in the preparation phase is making sure that any client is prepared for hard emotional material. So I think a lot of folks struggle with vulnerability. And even if they've talked about their story 100 times over, if they're kind of in a news reporter state where it's like, I'm giving the facts of the who, what, when, where, why, that's very detached emotionally. So it's like, the beauty about EMDR is it doesn't require someone to go there verbally. As long as they can get there and go there emotionally and activate where those scenarios live, that's the important thing. So for someone who struggles with, I really don't like going there, we want to make sure that they're fully equipped. So preparation involves using and equipping a client with internal resources. So that could look like some imagination work. That could look like finding a calm place so that you're able to visualize that in your brain and be able to go there to kind of retreat for a few minutes. For some people, it could look like container is another popular exercise because it's about constructing a mental container that can hold all the hard and the heavy so that I have control over it versus all my hard experiences popping out at me like unwanted dandelions. So if there's a secure container that can contain everything I need it to, then I have some agency about how much I want to work on and how long I would like to work on it. And then I could put things back in the container. And so I could have more power and control in that versus this unsightly Pandora's box coming at me. For other folks, preparation can just look like building social supports. Self-care strategies, deep breathing exercises, physical exercise, finding a team of support persons that you can go to in a time of need, because, it's kind of in a casual way, EMDR can get in your stuff, to kind of put it lightly. And so if you're going to get to the hard and the heavy of some emotional hard things, you want to make sure you have a team of support or other coping strategies and resources to help you work through those, so that progress happens much more efficiently, because EMDR likes to use the term window of tolerance. And that just means that we should be in this Goldilocks zone, that things shouldn't be so hard that I'm in fetal position and in panic mode, and things shouldn't be so detached that I'm numb and void of feel. So I should be somewhere in the middle. This is hard and this is icky, but it's an icky I can sit with and not be overwhelmed by. So when I can sit in these hard things and it's bearable and it's tolerable, that's where the healing process will happen. So we want to make sure our client is ready for that, for the hard things. And so sometimes preparation might be widening that window. I've had several sessions where folks can only handle maybe a couple of minutes in their emotional material, and they're like, Sarah, I'm out. And it's like, that's okay. You know how much you can take. So you're in a little bit, out a little bit, in a little bit, out a little bit. That's completely normal and okay. Because if we respect that window of tolerance, you're going to see, slower sometimes can be faster for some folks.
But you know how to handle that. Like, you are the professional and you are able, again, like you're saying, to prepare them for this. And then when you're actually in the moment, being able to say, okay, it looks like this is enough for today, or it looks like this is enough for now. But you have the experience with that, and you're able to know what to do when you're in that situation and when the client's in that situation. So they're in good hands with you.
Yeah. So I trust that clients kind of know themselves and have, and this is also what's different from EMDR compared to some other traditional therapies, is that EMDR's foundational principle is that clients have the capability of healing themselves. It's just they just need a facilitator. They just need a guide, someone to kind of help coach them along. So therapy is not about Sarah having all the wonderful gizmos and ideas that heals their life. It's like, no, the therapist is actually pretty removed from the processing piece of it. The therapist is there for moral support and to be a validating, safe space and to guide. So as long as clients are processing and making movement, we don't need to do anything. Okay. And so I think that was different, because I'm usually one that's like, I hate awkward silence, but it's like, but I have to reframe that in my own brain, that when there's silence and the clients are just kind of working through their stuff, that their brains are working through the things on their own. They don't need me to do that for them unless they're stuck. If they're stuck, or their distress is elevating, or there's something kind of going off the rails, then that's where I'll kind of come in to make sure that things stay within the window. But as long as things are moving, let the client do what the client's got to do. You don't have to intervene or be the lead or the take charge person of their process. They have the know-how and the front brain and the skills and the resources to do that on their own. So we're just kind of EMDR gives the client that space to do that. And that's what I that was also what was really different, because it's like, ooh, the therapist is the expert giving me all the things. And it's like, no, clients have that. They just need help to access it and get their own brains to start communicating that we have what we need to heal.
Which sounds really empowering. Right. It can give the client more of a sense of, oh, my body and my mind do want to heal naturally. And I do know myself, and I do know what is right and what is too much and what isn't enough. So I like that. Can you tell me a little bit more? I know we don't have a ton of time, but can you tell me a little bit more about what kinds of results your clients have told you they've experienced, or how they, I know sometimes a good question when you're working with a client is, how will you know that therapy has been effective for you? So what kinds of results have your clients seen?
So it definitely varies from person to person. I think for some folks, what is success in EMDR is getting distress from, if we say like a 0 to 10, 10 being fetal position, unbearable, to 0 being calm or neutral. When I can think of a distressing event and my body, my feels are able to be a 1 or a 0 about that, and it no longer resonates distress in my life, that's success. For other folks, it could look like not only is that distress a 0 or a 1, but now as I think about that event, like, yes, it was horrible, and yes, it was awful, but here are all the amazingly cool things about myself now, about how I'm empowering myself, about how I'm making decisions for myself now, to kind of own and kind of accept that, like, I don't have to like the fact that I'm a trauma survivor. I don't have to like the fact that these things happened, but they did happen. But here's what I'm doing with it, and here's where I'm going in the future with that. And so I've seen some folks become amazing advocates, or just kind of empowered in other areas of their life, because now they've kind of have incorporated survivorship, or these experiences as part of their identity. So for some, it's like a heck yeah motivator of going places in the world. But I mean, I've also had some, like, I had a female client, and she was dating someone. And so success for her was like, I'd like to have physical intimacy without crying.
Yeah.
That was success. So that I said, well, I'm not a licensed sex therapist, but I will, we'll do EMDR to what I have the scope to do. And she was able to have that intimacy and not see her offender's face on her boyfriend. Like, that was success. So I think that's again the beauty about EMDR. They get to kind of define what that looks like. And it's always amazing to see how those definitions are drastically different from the start of EMDR to after. Because I can't tell you how many times I've worked with a client where they're like, I just can't imagine that would be possible for me. There's just no way I could see myself ever feeling healed, in that way. And then they process the trauma, they get that big relief moment, and then they're like, wow, this is feeling empowered. Healing is now second nature, or it feels just like, oh, I would have never thought about this for myself, weeks or months ago. So that's what I have to remind some clients, is that sometimes thinking about what healing could look like could really change, through EMDR, as things start healing and processing and shifting, and as that front brain really starts kicking in. And it's like, yeah, we could do some really good things that we at once couldn't believe, before it all started.
One thing that when you and I, just over time as we've talked, I really love it when EMDR comes up and we do talk about it, because you light up and you just get like, yeah, you can do this, you can do that. And you get really excited. And I've just been so glad to have you here, to have you join our team and be able to help our clients. That's something that's so important to us, is that our clients have someone that can work with them and that they can have a dream or they can have a goal, or sometimes, like you said, they can't even imagine being able to live the kind of life that is a possibility for them, and then to be able to work through the issues that they're going through and become bigger and better and stronger on the other side of it as a result of the work they've done with you. So I just want to say thank you, first of all, for taking the time to talk with me today and let us see a glimpse into EMDR therapy, and also just for the good work that you're doing, the good work that you've done in the past, even when you weren't here. I know, like you said, you've had a history of working with people who have experienced violence, and you've just got a nice wealth and depth of experience. So thank you for bringing it here to True North, and thank you so much for the work that you're doing with your clients. Is there anything else you'd like to say? Anything else you'd like to say
well, I think now that I've like been doing it for a good while, I think there was definitely in the early months, I'm like, am I doing this right? Like, I don't know, but like once I saw it work the first time, and I saw a client get to that, that ending of like things hit a zero, and those more adaptive or positive thought processes start happening of like, trauma made me think blank about myself, and that is complete crap. And I am the polar opposite positive piece of that. I was like, sold. I'm done. Like, this is it.
Yes.
Because I've had so many sessions with a CBT approach that it's like I'm bashing my client over the head, like, you're amazing, you're empowered, you're great. And there's like, it's just not sinking in. And it's like, because we need to process the trauma. We need to find the roots, clear those roots out, process those so they're no longer an issue, so that once those are finally done, the client is able to utilize their whole brain, whole capacity, whole self to like kick butt and take names. And it's like, I love being a part of giving clients the space that they need to do that. And not to mention a lot of those many interventions, maybe to be continued in the blog series or another video of some really cool things that EMDR can do outside of a standard protocol. Because training only does like a standard protocol, but I've done some really cool trainings on working with attachment trauma and racial trauma and dissociation with complex PTSD. So like EMDR can do some really cool and additional things over and above a straightforward approach. So I love nerding out every time, and we'll be glad to do it again.
Wonderful. Wonderful. Well, if anyone watching this is interested in getting a chance to work with Sarah Nolan here at True North Counseling and Development, if you'll just call 859-740-7374, then we can help to get you connected. Or you can check us out on our website at www.truenorthlex.com. Thank you so much, Sarah. You have a wonderful day.
Thank you, Janelle.
Thanks. Bye.